Kula Vinaka, Assalamu alaikum, and a very good morning to you all. I totally agree with you, Melinda, that October is very painful. It's a very painful month. Every year, we come together to mark this important occasion, important month, Pinktober. We wear pink, we have pink cupcakes and pink cakes, and we raise funds. We remember the people we've lost. We remember those who are struggling with cancer. We remember the children who are mostly affected by this. Yet, we take this matter very, very lightly. In fact, we take our health very lightly, especially as women. We look after everybody in the family, in the community, in the nation. But do we look after ourselves? That's a question I'm going to ask. Every year for 30, 31 days, we talk about Pinktober. I suggest January to December should be declared Pinktober months. It's an issue that is so important to us. It's an issue where we really need to fight this together as a community, as a family. And that's why the theme, no one fights alone. But what actually happens in reality is people are fighting alone. You know why? Because of the stigma attached to cancer, any form of cancer. It's scary, it's painful, and it's deadly as well. Not only cancer, but any health issue. So we have a lot of issues in the Pacific and especially in Fiji. Our NCDs, what we eat, there was talk about eating the right food. How many times are we going to remind people to eat the right type of food? Is it something that should be reminded now? We live in a very highly educated society. Everywhere you turn to, you hear about NCDs, highest rates in Fiji and the Pacific. We are blessed with abundance of fresh fruits and vegetables. But the choices we make in regards to our health is probably one of the biggest reasons why health issues continue to plague our country and our families and our people. I mean, when you talk about health, what are you talking about? Healthy living, making sure our families eat healthy, making sure the nation produces healthy foods for our people. When you go to the market, what do you see? See abundance of fresh fruits and vegetables. What do we end up buying? When we go to the supermarket, we look for canned and processed foods. That could be one of the reasons. Even though they may be expensive, but yet we go and choose a fatty corn mutton, a tin of tuna, when we can easily go and buy some roro from the market at a much cheaper price. So it all has to do with habits. It all has to do with the type of lifestyle we choose for ourselves. I'm a victim myself. I haven't been diagnosed with cancer. I'm probably one of the lucky ones, but recently I had a major health scare, and I want to share it with you because you should know. Health diseases spares no one. If you are careless with your health, you will suffer. I suffered. I haven't said this publicly to anybody, but I think it's right to tell you what happens when you are careless with your health. I don't know whether you'll believe it or not, but 4 months ago, I had a major stroke. I lost all feelings on this side. And I was shocked, as shock can be. I didn't know what to do. Lying in bed, needing somebody to help me get off the bed, have my shower, even eat. This hand was gone, totally gone. But I thank God for the strength that He's given me and the support that my family gave me. And I will also reiterate the fact that you must trust our doctors. I didn't go overseas for treatment. I stayed here in CWM. And if I can stand and walk today, I owe it to them. I had Belinda talk about doctors and how good they are, how passionate they are. We may have some gaps. Normally we hear the health system being criticized by everybody, the public, But we have to understand they are people. Our doctors work with resources that is given to them. But you cannot take the passion that they have for the work. Our healthline workers, our doctors, our specialists, for me they are very good. So you must have faith in our own doctors. As mentioned by our cancer survivors, they work with passion. I've worked in the health ministry for about 2 years, and I've seen what they do, the lengths they go to ensure that their patients are made comfortable. So everybody seated here can be an advocate for good health. Whenever you are talking, as mentioned, conversations around health issues must continue. Conversations around breast cancer or any form of cancer must continue. How can we make sure that is done? This year what the ministry did, we tried to uplift our awareness campaigns. We partnered with Soroptimist International, who has 10 branches across Fiji, 10 clubs across Fiji. And we hope that the support we gave Soroptimist International this year will make sure that information pamphlets are delivered to every household within the 10 districts. Suva included, Ba, Lotoka, Tavua, Nendi, very active group of women. There are many who continue to ensure that information goes out to people. But what happens if the information is not taken heed of? What if we don't go and have regular checks? How many of you sitting here have had your pap smear? I'm not going to ask you to show your hands, but please, if you haven't, I'm sure if the hands were to go up, many, even mine would go up too. But at least from today, take your health issues very, very, very seriously. If you haven't had a check by your doctors for pap smear, go and have it done. It's free. It's hospitals and health centers and nursing stations are very close to our societies wherever we live. We have a lot of nursing stations where you can get early advice. As mentioned, if you detect any disease early, there's always prevention. Your lives will be saved. Over the years, I've had hundreds of survivors talking about their stories. We must learn from them. What did they do wrong? We shouldn't do it. What did they do right? We should follow it. There was a mention of traditional medicine. A lot of people believe in traditional medicine. It's okay, you have your beliefs. But it doesn't work. It may work for one, it may work for not the other person. Okay? It actually delays the treatment. Years go by because we are scared to go. What if the doctor tells me I have cancer? I'm sure that thought is within all of us. What if I'm diagnosed with cancer? Because we all know cancer kills. But believe me, cancer is also cured if detected early. So talk about it within your organizations, talk about it within your families, your daughters, even your spouses. Men are an equal partner in our fight for this. There's no harm in involving men in your families to talk about it. I've heard cancer survivors telling me that their husbands left them, their spouses or their partners left them the moment they were diagnosed. This is very painful. There's double the pain. So if we involve men in this battle against creating awareness, I'm sure we all will be winners. And of course, why not? They are part of your family. So any man who deserts his family or his spouse because she has been diagnosed with breast cancer, whatever stage, is a coward. He's a really coward man. We don't need men like these in our communities, in our families. We need strong men who would stand by their women, no matter what. And children, sometimes we forget that the children are the most affected ones. They lose their mothers. They lose their caregivers. Families also lose their breadwinners through this disease. So what happens to these children? Now, actually, I would really like the ministry staff to go and visit those staff that we lost due to this and see how best we can support their children, how best they can be supported. That's what it is. No one fights alone. The work of the Fiji Cancer Society should be commended at the utmost level. They are here to fill in the gaps that exist within our systems. not everything can be done by the Ministry of Women or Health or the government. And this is where our partners come in. So it's very important to commend the Fiji Cancer Society for the work that is done. Every dollar that is raised through awareness programs and Pinktober teas goes towards providing comfort and support to our women who are diagnosed with that. So, Linda, thank you very much. Our other partners who provide counseling, MSP, Empower Pacific, they must also be commended. The conversation, the work around this must continue and must continue. And as a ministry, we will do our part to see how many families we can reach. But at the end of the day, it's the decisions that an individual makes. We live in a very educated society with a very young population. It's simply because we disregard our health. We don't take our health seriously. We don't scrutinize the food that we eat. Now we are told it's just a flat piece of meat. What do? When we see barbecue, count how many lamb chops pieces would you be eating. We are all guilty of that. It's our culture. We love to eat our food. Okay, but then what's the result of it? It affects our health. It affects our family's health. It affects our children's health. And of course, overall, the nation's health is affected too. We need healthy, productive people to take Fiji forward. And young staff of ministry sitting here. What do? We take the lift, eh? Remember that day at Lautoka, this retired nurse was telling us, it's the society is so much into pressing the button. Pressing the button. Switch on the gas, cook the food. Lift, instead of taking the stairs, you walk up. Press the button for everything. Even the remote is there. You don't want to walk to the TV or put the switch on. Everything is remote control. It's a lifestyle. There are advantages of this modern society, but there are also disadvantages of the easy life it has created us. You sit here, press the button, things are done. And some people sit and the whole gate opens and everything is remote controlled. But the choice lies with every individual. So to all the women out here and all the women out in Fiji, including the rural maritime areas, please prioritize your health. It's very important. Your family depends on that. And there's no harm in talking about it. If the doctor has diagnosed it, if you have had an early checkup and early detected, it can be cured. Don't be scared. I know it's very scary. Sometimes saying things is easy than having it done. Eh? So all the staff sitting here, can I have your assurance that you will go for your checkups today? PS is here, please. It's no use talking, it's putting things in action. So find some time out today, or we can get some nurses to come and, well, check us, me included. I'm just saying that. So me and PS, we will lead the team for a checkup this week, or today, or tomorrow, but it has to be done. Don't procrastinate. Don't leave it to another day. It doesn't help. Okay? So I hope that this year we will be able to reach many families, many households, many women, and actually encourage them to go and have early checks done. And to the men, please stay by your woman if she's sick. A woman is still a woman without her breast. You know, it gets, oh my God. Even if it was to do with us, we would be scared, right? It's painful, it's scary, but we are still who we are without a breast missing. So if that is the last resort for women to have the breast removed, please be bold enough and families to support their mothers and daughters so that they go through the surgery and procedures with much care and comfort. It's a battle we'll have to fight. It's just like the gender equality battle we are fighting. Some things don't come easy to us. We have to fight and continue to fight and continue to fight. And we have to continue to keep the conversation, keep talking about it, keep talking about it. So a day will come when everybody, without even being reminded, will make their way to the health center and say, okay, can I have a check done? Can I have a pap smear done? Or can you tell me how do I see whether there's a lump here or there? What does it feel like? And I've seen scary pictures shown to me by the doctors about the stages in which our women reach the hospital. Some women reach the hospital when half the breast has rotted away, believe me. When half has rotted away, there's pus and blood and everything everywhere. Where was the family that time, I'm asking? If you have a woman suffering in your house, and believe me, they say it smells very bad. No offense, but it does smell very bad. So how can you be in a family where your mother or where your wife or your sister-in-law is going through that painful experience? So we question the family too. That's why we have to say no one fights alone. If there is support from the family, from the loved ones, every woman would be bold enough to embrace it. Okay, I have cancer. This is what I can do. This is what I have to do. But if there is nobody to support, you know there are organizations and individuals out there to support you. Fiji Cancer Society being one of them. So yes, October is not a very, very happy month. It's a very painful month as we recall those we have lost. Some of us are lucky, we haven't lost any in our family. But believe me, it doesn't spare anyone. It's somebody today, it will be somebody else tomorrow. So keep up the fight. And once again, thank you all our stakeholders, all our partners. Thank you all for the support shown during our fight for this cause. And we will continue it. Well, Linda, I know this is off the cuff, but I must thank you for the work that you do. And today, like I said, Ministry supported the Sorrow International to create more awareness. But I, on behalf of the Ministry, pledge you $5,000 for the work that you do. I hope that money will go towards providing some support and comfort to our women in Fiji. Thank you.
The Honourable Minister, Madam Rosy Akbar, distinguished guests, ladies and gentlemen, it's indeed an honour to be here in front of you to talk about the work of the Society, but even more, breast cancer awareness. The theme of this year's Pinktober is No One Fights Alone, and that basically echoes the work of the Fiji Cancer Society, being with you from day one as you attend our screening program, where you've been identified with a lump and referring you onwards to the Ministry of Health, public hospital. Sorry, I didn't come prepared. I normally wing it. And so the referral, we're there with you throughout the process. As you get diagnosed, you get treated, managed, as you continue your journey into survivorship and then into palliative care. So the focus of the Society is basically from the initial stage across the cancer spectrum. I dislike October. It brings back a lot of memories. It brings back a lot of emotions because it reminds me of women who I have started, who were there with me when I first started at the Society. And the Honourable Minister will know that. She was Minister then when I started, and she has been a great force in supporting us in our work. The one thing I have noticed over the past 7 years is that although women are still coming in late, we have now seen the awareness platform has taken a level up where women are now coming in a little bit early, which means they're diagnosed early, the outcomes are a lot more better as opposed to when they come in late. So all this is to do with the awareness that's been created. Everyone understands and knows what the month of October is. Besides it being Fiji Day and Diwali, it's also the month of raising awareness on breast cancer. So for that, I am truly grateful. If you have been talking, having those conversations with your families, your work colleagues, congratulations. Continue to do that. We must not stop. We are it's just human nature where we come out, we leave things till late. And so by the time we go to the hospital, we expect the doctors to perform miracles. There is nothing wrong with the current cadre at the hospital. we have a pool of committed and passionate doctors who could have left the country for greener pastures, but because of their commitment to the people, they still remain with us. These doctors do the best they can despite the challenges they face. Fiji Cancer Society comes in and helps fill those gaps. If a patient needs transportation, they reach out to us and tell us she needs transportation, he needs transportation. If there is a need for grocery pack, they do that. Diaper, they do that. So we fill in the gaps. We're more the humanitarian face of cancer. Not many people are aware of the services we provide, but these are the services we provide, and the funds raised from these services allow us to put it back and give it back to the community. There is no charge for these services. Besides care, patient support for our patients and their families, we also have an outreach team that goes out into the communities, into the corporates, to do screening, to raise awareness on cancer, and get the community talking about the importance of those conversations, the importance of reducing your risk factors, which are alcohol consumption. If you are drinking alcohol, consuming alcohol, please enjoy it responsibly. If you are smoking, consider quitting. Tobacco is a risk factor for cancers, for a good number of cancers. Lung, there's breast, there's also prostate. Learn to do some form of physical activity, 30 minutes a day. There is Wellness Wednesday, I know, but let's not keep it to Wednesday. Let's continue the other days as well. If you have elevators in your office, take the stairs. If you have to take a taxi to town, I'm sure your office is not far from town, walk, okay? These are going to reduce your risk factors for cancer. When it comes to eating, reduce your carbs, your kakanandina intake. Have the good ones. Plantain, vundi, yam, kumala, those things. Have a plate full of colors, the rainbow. Okay? Have your meat, just the palm of your hand, flat. Doesn't have to be lumped. But eat a lot of vegetables, a lot of fruits, mangoes in season, you can do smoothies. Those are the things you can do. Smoothies, freeze your mangoes that you can have off season. And more importantly, stress. Learn to manage your stress. Last week I told the staff at EY if they could look at introducing a mental health day off for their staff at least once a year to allow staff to remain at home and unpack your professional life, unpack your personal life, then you reprioritize it accordingly. Women, we need to make time for ourselves. Our health is more important. If we don't, then what happens? Time and time again, we've seen women whose husbands have walked out on them because of a cancer diagnosis. Okay? If you don't prioritize your health, then there's consequences to face. But please, don't let it reach that stage. October is the month for breast awareness, but January is the month for cervical awareness, cervical screening. How many of you have had a pap smear in the last 3 years? If you haven't, take yourself to the nearest health center. Contact us, contact MSP, contact RAF, and go and have your pap smear done. Pap smear, cervical cancer is a gender disease where only women can get it, but it's one that can be caught early. Okay? So you have precancerous stages. If you're caught then, it hasn't developed to full-blown cancer. That is the only time the doctors can treat you, send you home, and make sure you attend your appointments on time. Never, never neglect your health. Your health is your wealth. You want to be here for your children. You want to see your grandchildren, so please take care of yourself. Men, it may be focused more on the women, but I think it's for you as well. Be there. Learn to take care of your health. November is Men's Health Month, but it's also men's mental health. You don't have the capacity to talk to people, to talk to your friends, your colleagues, but please do that. You need to start having the conversations. There's nothing to be ashamed of. Last week I heard that a man that was diagnosed with prostate cancer completed his chemo cycles. 2 weeks later, he committed suicide. Very, very important that you need to have those conversations. Men, if you can't talk amongst your group, talk to your spouse. Women, the same thing. Talk in your group. Over a cup of tea today, please, have that conversation. Who knows? The lady sitting beside you may be going through something in her life that she's not comfortable. May allow her to open up, listen, notice the body language, listen to what she's saying very, very carefully. See her gestures, see her facial expressions. Try and read into those things and be there, because cancer is a disease that no one should fight alone. Nobody should fight that dreaded disease alone. So please, 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 I have seen over the years, we need to have the conversations. Don't let it be confined to October. You can get cancer any other month. October is because that's where the platform, the hype is all about. If you allow us, together with our partners, MSP and RAF, bring us into your organization, conduct screening in the workplace where it's a lot more comfortable, a lot more private, allow us to do that. We have a clinic. If you want, you can come down to our clinic right beside our office at 333 Waimanu Road. Come and see Sister Caro at the same time. Have a pap smear. If you need thermal ablation, precancerous treatment, thermal ablation or colposcopy, that can be done at the office. There is no need to go to Lancaster or no need to go to the nearest health center. We're there, we're here to help you. I see my colleagues here from MSP. They're doing fantastic work as well in women's health. So please, just reach out to us. We're only a phone call away. Mele, our survivors network, we have a very strong survivors network. That's where they go get together and then they talk about life's problems, how they're going to solve life's problems. But at the end of the day, it's the camaraderie, it's the warmth, the love, the support they're able to offer each other. And that's what the work of the Cancer Society is all about. So thank you for this morning. Thank you for the generous invitation. And remember, you need to know what's normal. Reduce your risk factors. And even more, let's have the conversations. Thank you.
The Minister for Women and all the beautiful ladies present here today. Malo and a big bulavinaka to you all. First of all, I'd like to thank the Lord for his love and mercy, for without him, I would not be here today. Secondly, I'd like to thank the Fiji Cancer Society for inviting me over and providing the environment to enable me to share my story in overcoming this deadly disease, which is cancer. And thirdly, I'd like to thank the audience for giving your time to listen and hear my testimony. And I hope this will enlighten or inspire someone here or out there to never lose hope for as long as you have the breath of life. Well, my name is Mele Koroi, and I am from the beautiful island of Mavana, Vanombalavo in Laos. I am 50 years old, and I'm married to a husband from the hidden paradise of Savu-Savu. We have 5 children altogether, which consist of 4 daughters and 1 son. And our eldest is 29 years, and our youngest is 18 years. I was diagnosed with a stage 4 breast cancer, which is the worst or last stage, and sometimes also known as next to death. As we all know, that even the mention of this word cancer brings fear to our society because of the devastating effects of this deadly disease. We can talk about it today, tomorrow, next month, next year, and so forth. I do understand from before that cancer has no cure. but I can proudly stand here today and testify that I am a cancer survivor and a cancer-free woman, proven medically for it's been over 10 years now. It's 5 years before I diagnosed and 5 years after diagnosed. So I'll talk about that as we move along. And I thank God and the medical team at the CWM hospital for their great services. Well, my journey was not that easy because I went through many obstacles and challenges in life. I had fear, I cried, I felt pain, I was confused, I was kind of lost hope, and even said goodbye to my family. But my faith kept me going in that desperate time. I would also say that I was so blessed that my family's support was always there. My honest and dedicated husband and my 5 amazing children were my strength and my pillars. And by seeing them with their support and dedication every day, it gave me strength to carry on and never give up, because I don't want to lose them or them losing me. Back in the year 2012, I first noticed a lump on my right breast, and I went straight to the hospital to see the doctor. From there, they took samples from my breast and told me that once they obtain the result of my diagnosis, they will operate and remove the lump if it's 2 centimeters or less. But if it is more than 2 centimeters or plus, they will remove the whole breast. With doubt and fear, I turned and walked away from the doctor, for my mind couldn't accept what I was told. In particular, the removal of my breast. I came home heavy-hearted and decided to do herbal treatment, believing that this would be the best option and cure. In between these years, 2012 and 2017, almost 5 years, I stayed home seeking and doing herbal treatment. And to be honest, you name any herbs, small or big, whether it's leaves, branches, roots, or trunks, I've tasted them all during this desperate time. I am not saying that herbal is not good, but it also has some major contribution in the detoxification of my body system. Late 2017, I finally made a decision to revisit the hospital because the lump grew in size until it burst out. The pain was unbearable, and I knew then that herbal treatment couldn't cure my cancer. At this time, I was ready to accept any treatment from the hospital because I then realized that I am heading nowhere with what I am doing. So I went back to CWM hospital after 5 years and was on emergency. Please don't get mad on me for my late obedience. I got admitted at once due to the seriousness of the disease and got operated. The operation was successful due to the best services of the surgeons, doctors, and nurses. And 5 years down the lane, I am still here enjoying life with my family and friends. I learned many lessons through my experience on my journey, and I want to encourage and inspire audience today that there is only one life. Diseases can only be easily cured when it is still small. Please always seek medical assistance or see a doctor once you feel any abnormality in your body. Be obedient to the doctor's advice and don't delay obedience or run away like I did, because you will surely end up in the hospital no matter what, and don't make it a last resort. Never be afraid of the hospital or doctors or nurses, because they are there to support and taking care of your health, to heal you and cure you from such diseases. They are heaven-sent humans with their God-given talents to treat you. Never be ashamed of what you are going through or what people may say. Avoid negativity talk and mind, and be bold always when you face obstacles in life. Always have a happy and joyful heart, no matter how worse the situation is. And do not stress yourself or worry a lot, because through my experience, these are the two main enemies of this disease. Also to you family members or carers, you also play a big role here in supporting patients. Your support is what our hearts desire, especially within the family, as this adds more healing to our body and mental issues as well. In addition, always remember, you are not alone in this fight. I've experienced and witnessed our hardworking and trusted medical team of doctors, surgeons, and nurses in CWM Hospital. Services is more advanced with all their medications as well. Even services are free, and I also salute them for their friendliness and hospitality. Also a big Vinakavaka level to these non-profitable organizations, the Fiji Cancer Society, who has proven record over the years, caring and assisting and support patients from when they are diagnosed through their journey with cancer. And just to name a few, they provide transportation of your pickups and drop-offs at your doorsteps in your everyday clinics and review dates. They do home visitations for patients who are bedridden and supply them with medication, diapers, sanitary pads, groceries, etc. They even provide prosthetic breast and special bras for women who have undergone breast surgery or lost their breast. They do free screening and awareness programs, pap smear tests for us, Fijians, and many more. And aren't we are so fortunate to have all this support from such organization. As I am a witness myself, and I also want to salute them for their never-ending support and caring heart. And finally, it's been over 10 years now, and I'm looking forward for another 20 years at least. I fought, I cried. I hurt, I smiled. I loved, I healed. I believe, I survived. Because with God, nothing is impossible. And that is a brief story on my journey. And thank you for being a good listener today. Binaka Bralevo.